Thank you so much, Dr. Anshika, for that introduction. I think Dr. Himanshu has already finished my presentation. He has told everything so nicely about how important empanelments are, that there's very little left to say. However, I'll try to elaborate and tell you why incorporating government schemes in your practice is so important. And it is my faith and belief that the target audience who we are talking to today is the younger generation who have just started their practice or are going to start their practice or have just spent a few years beginning their practice. I would first like to thank Dr. Rohan for inviting me to give this talk today. I would like to thank Dr. Pooja and the entire IRSI Young Brigade team who are doing a wonderful job of making these talks, bringing these talks together. Now, I was thinking of be presenting this talk, and I asked my office to give me a list of companies that we are insured, empaneled with. And we have companies who we are empaneled with right now. And when I was looking at this list, I saw this CGHS, ESI, and Airport Authority of India, BSNL. Some of these which are in the first 5 lists are some of the companies with which I got empaneled in 2001, when I had just started that time empanelment was not such a in thing. Everybody had a solo practice, everybody and at that time I went ahead and we were one of the first hospitals in Bihar to get empaneled, and even today were some of the maximum empanelments in Bihar in the different hospitals. So that is the time I'll be speaking on this topic to the younger generation, where I have already done all this by myself. And once you have empaneled with the government organizations, then the ball sets rolling, and then it becomes a breeze to get empaneled with other private companies, because getting empaneled with the government companies adds a lot of credibility to your practice, adds a lot of credibility. Now, beginning with why it is so important is the key word is cash. These post-COVID times have faced difficult economic hardships. From these hard times, they are looking for places where things can be done in a cashless manner. Also, the government of India is working very hard towards digitalization of the entire economic system. So there is less areas or gray areas where money can be not accounted for. So not only is it is becoming easy for the patient, it's also becoming easy for the doctor. Now, initially, to begin with, when you are starting your practice, it may be a good idea to show as much income as possible in an accountable manner. So when this cashless thing happens, it goes straight to your account and everything is accounted for. The more income you show, the more eligible you become for different kind of loans, because initially you have to take loans to buy different machines, and your eligibility increases as your income increases. Now, to go for this cashless, you have to get empaneled with different government organizations, with different public sector units, or the different private third-party assistants which are there, which are being used by HDFC, ICICI, and those kind of banks. The credibility of any center is most enhanced by the lines when you write empaneled by CGHS. Now, there are a lot of other government schemes also, but the primary scheme which is there, it's called the Central Government Health Scheme. And once you have empaneled yourself with the CGHS, then your center earns a lot of credibility, and it becomes a lot easier for other institutions, whether it is government or it is private, to enroll yourself and take you on board. To make the process of empanelment with N number of organizations, first begin with getting empaneled with CGHS. And I'll tell you why it is so important and why it is so useful. The rest of them, as I said, automatically will fall in line. The other government schemes which are there are the ECHS, which is the ex-servicemen health scheme, in which mostly the army people who are there, they get benefited with this scheme. The ESI people who are working in the factories and laborers, they benefit most, and all this accounts for a huge population of patients, all pool of patients which you get access to, which you will not get otherwise if you are not empaneled with these organizations. One of the largest health schemes in the world now, which has been started by Narendra Modi ji, our Honorable Prime Minister, is the Ayushman Bharat scheme. It has a huge potential, and once you get empaneled with Ayushman Bharat, CGHS, CSI and ECHS, you earn a lot of credibility and you will get a lot of patients. Initially, when you have limited access to funds, it's very difficult to put advertisements, so on and so forth, which are costly. And once you get empaneled with this, then by word of mouth, the good work that you are doing goes around. And then that in turn helps you in getting private patients also. It helps build faith and confidence for the beneficiary. A lot of patients who are then not beneficiaries of CGHS or ESI, they go and tell their relatives, I met this doctor and he's so good and he talks so nicely and his infrastructure is so good, and then they come and actually pay you money, and that is not cashless, and they pay you money and get themselves treated, so it adds more value to your institution. Now, even before you begin with empaneling with CGHS, there is something called Rohini with which you have to get empaneled with. Rohini is an organization which gives you a unique 13-digit ID with which your hospital will be recognized throughout the country. This is the number which gives credibility. They have done all your background check and seen all your paperwork that you are eligible to be empaneled with the different government scheme and the private schemes. And this is the unique number. It's like you as a person have your Aadhaar card. This is the Aadhaar card of your hospital. The Rohini number is the Aadhaar card of your hospital, which makes you, gives you a lot of credibility to CGHS. And so if you're not registered with Rohini, you cannot register with CGHS. Your form will not move further. Why should hospitals be part of Rohini? How does Rohini benefit them? Rohini is a game changer as it progressively opens up immense possibilities to rethink and reshape their strategies. It gives greater visibility, credibility, and branding. It helps in register and edits information. It broadcasts address or contact information changes in a matter of click to all stakeholders associated with them. It helps in making your claims faster, the processing part of it, and the electronic exchange of medical records between hospitals and insurance company becomes very seamless and very easy. So once you can go to see on the internet, you can Google registration with Rohini, and you can get your Rohini number. Is the first thing that you have to begin with. The next thing that you have to do even before you are applying for the CGHS is something which has been brought forward by the government itself. It's the Clinical Establishment Act, which was passed by the Parliament in 2010, and it provides the registration and regulations for all clinical establishments in the country with a view to prescribing minimum standards of facilities and services which may be provided by them. So we all know that there are so many quacks in the country and there are so many illegal things happening. And for a huge country like India, to regulate things, to streamline things, to make sure that its citizens get the right kind of treatment, it was very important to bring this Clinical Establishment Act. Some of the acts thought initially were very harsh and very tough for the doctors to take care of, but now it has become much easier. And for the eye hospitals, it is even easier. The act has a little leniency for the eye hospitals because we don't have to meet all the standards. Now, who are the recipients of the central government health scheme? The current working representatives of the central government, their employees, their needy relatives who are dependent on them, living in CGHS secured regions. Existing and former individuals from Indian Parliament, former governor, lieutenant governors of India, freedom fighters, former vice presidents of India, existing and former judges of Supreme Court, workers and pensioners of choose self-governing associations, journalists, police personnel, and workers of railway board. Now, other than those who are beneficiaries of CGHS, which is a very, very large pool, and you get access to all those patients, and they are there in all the cities, we also encourage you to get empaneled with ESI, that is the Employee State Insurance Scheme, in which there is a large pool of patients who go for these patients who go to the factories, who are working as laborers, and these are the patients who get a lot of trauma also in their eyes. They are so in their eyes, so there's a big pool of patients if you get empaneled with ESI. The ESI state insurance is an integrated measure of social insurance embodied in to accomplish the task for protecting employees as defined by the Employee State Insurance Act 1948. Now, we have the ECHS also, which I said is the ex-servicemen. It's the Department of Ex-Servicemen Welfare of the Ministry of Defense. And it has recently come out with a clarification regarding definition of empaneled hospitals under ECHS. Hospitals or nursing homes, dental care facilities and diagnostic centers for specific treatment and diagnostic procedure of specialized nature are allowed to be empaneled medical centers. Hospitals need to furnish an undertaking to ECHS accepting the rates notified by CGHS. So each of these government organizations are very particular that you give the services to their patients, to their beneficiary, that CGHS rates, even if it is ESI, even if it's Ayushman Bharat, even if it's ECHS. Now, this is a copy of the letter that my hospital sends to all the different organizations when we are there for empanelment. And since this is for the younger generation, I thought I would put this and I hope this meeting is being recorded so that you can later go in and see it, see the different things that we write. And there are 14 points which I put over here. I send my letters and it almost seamlessly gets empaneled by the different organizations that I send my letters to. Recently, we sent it to CBSE, the Central Board of Secondary Education, and yesterday we got a letter that now we are empaneled with them. And there's a huge pool of teachers around the country who are associated with CBSE, and now we will be giving our services to them. So always, constantly, I am looking for organizations and looking for places where ABI Institute is not empaneled, because there are so many organizations, it's virtually impossible. And this is also, CBSE is also one of the government organizations, and we have empaneled with them recently. It's not necessary that if you are empaneled with CGHS, automatically you get registered with all the different government organizations. You have to tap each one of them separately, like Food Corporation of India, CBSE, so on and so forth. Now, when I send my letter for empanelment, I also send a photo gallery of all the different facilities that are available in my hospital. So whoever is empaneling, whoever wants to decide whether my hospital is worthy of empanelment with that organization or not, the inspection does happen. But at the first glance, when he sees all these pictures that are there, he gets a good impression of what your hospital is all about. So you also, when you are sending your hospital for empanelment, however small or big it is, you should not bring a block into your mind that my hospital is very small, so it will be very difficult to get empaneled. A small OPD room, a small operating theater, a small inpatient area. If you have all these systems properly, even the smallest of the hospitals get empaneled with CGHS, because in the parameters are much lower than for general hospital. I also send them a picture of the different equipments that I have so that they get a good idea of what their beneficiaries will be benefiting with if my hospital is empaneled with them. Now, this is the requirements, guidelines for empanelment for private eye hospitals under the CGHS scheme. The eye clinic, when you are applying, it should have at least an operation of 2 years. You have already worked, so that you have your balance sheet with you, a copy of the list of the treatment and procedures that you do. And it is not necessary that you should be doing all the squint surgeries and the retina surgeries and the oculoplasty, then only your hospital will be empaneled. If you are doing simple cataract surgery also and doing only anterior segment work, then also your hospital will be empaneled. The other important thing which I wanted to tell you is that when you are applying for these CGHS schemes, you will have the form online. Never write in the form not available. Always write outsource. Your friend will be there who will be doing oculoplasty. Somebody else will have an ambulance which is there. Pharmacy may be outside. Everything that is there in the form, even the vitreoretinal work, you can always write outsourced, outsourced and outsourced. Never say not available. in the CGHS form when you are filling, or in any form that you are filling for empanelment. You can always guide your patient, you can always tell them, you can always refer them, and you can always write outsourced, and you can always make an MOU with some center showing that your vitreoretinal services are taken care by that hospital, and you can always attach that document. So a copy of the document related to the compliance with necessary statutory requirements are attached with the paper, like waste management, fire safety. Some of these things are very important, and they do take a little time. If you are applying for fire safety, if you are applying for biomedical waste certificate, they take time, but it's very important for you to have patience. Give them 2-3 months. The certificates do come. They cannot sit on it. They cannot stop it. It takes a little while, but it does come over a period. I have learned this, that apply somewhere, leave it. Even the government works. They don't sleep on every paper that is sent to them. Takes a little while, but eventually they'll come and do your inspection, and they'll give you the certificate that is required. Now, the one thing with these guidelines are mainly for general purpose of the eye clinic. For specialized eye clinics, additional technical information will be required depending upon the type of specialization. Power backup facilities, fire clearance, certificate by third parties. These are all standard things which once you go through the form, you will see this. Now, I wanted to show you this, that in the form that is there, you have to fill all this which are there. And in the 8th number, you will see that there is cataract, glaucoma, retinal, strabismus, oculoplasty. These are the treatments which they want under the heading. And whatever treatment is available in your center, you can say available. Whatever is not available, you can say outsourced. These are the address of the different TPAs which I have put here. If this meeting is being recorded for the younger generation, I had showed you the letter that I had sent, and this is the addresses of the different TPAs which are there. You can make that number wise that I have mentioned, make an envelope and just send by registered post to all these addresses of your hospital which are mentioned here. So I have written about 25 or 30 addresses are here, which I am which you can, once if you are playing it back on YouTube, you can note down all the addresses and write letters to them to empanel your. However, these are not government addresses. These are the private ones, but I wanted everybody to benefit from this. So I have written the addresses also over here so that you can copy it and write to all the different TPAs to get your hospital empaneled. So these are the 25 TPAs which are there, which is very, very important for your hospital to be empaneled with. In fact, 28, not 25. Now, primary requirement by CGHS, ECHS or ESI, because my topic is dealing mainly with the government organization. So one of the important things that they will ask you is for QCI, Quality Council of India approval has to be taken to be able to apply for CGHS, ECHS or ESI. And you may or may not have NABH, but now they are slowly making it very mandatory that you have at least the entry level NABH for you to be registered with CGHS, although it's not an absolute must, even a QCI will do. Now, once you want to accredit yourself with NABH, what is accreditation? A public recognition of achievement of the accreditation standard by a healthcare organization demonstrated through an independent external peer. You may think that everything in your hospital is working perfectly fine. You may think that I am giving the best of the services. I deal with my patients in the best of the way. But it has to be seen by and assessed by a third party, a different doctor, to make sure that whatever you think you are doing best is actually good enough for the patient. Now, benefits of accreditation. Accreditation provides a high quality of care and patient safety. My hospital, which just is in the process of NABH, now any day we will be getting that NABH certificate, because we have covered the Quality Council of India and all those things much earlier. So now a lot of the things which I thought I was providing perfectly, small things they have rectified, which has helped me a lot in providing better services to the patient. Accreditation to hospitals stimulates continuous improvement. They give you so many files, so many entries that you have to make, that it helps you improve your hospital, your system, the services that you are giving to the patient, so that it helps in continuous improvement. Accreditation to a hospital, the staff is in an accredited hospital are satisfied lot, as it provides for continuous learning. There's a good working environment, leadership, and above all, ownership of clinical processes. These are the benefits of accreditation. Now, accreditation provides an objective system of empanelment and insurance and third parties. Accreditation provides access to reliable and certified information on facilities, information and infrastructure, and level of care. Now, requirement for NABH accreditation, the organization defines and displays the services it can provide. The organization has a well-defined registration and administration process, and there are appropriate mechanisms for transfer and referral of patients who do not match the organization resources, and during admission, the patient and or family members. So these are the different requirements of NABH accreditation, which makes the process much smoother, faster, safer, and better services to the patient. Now, imaging services are provided as per requirements. These are things which benefit so much to your organization also and to the patients also. Now, documents required for the NABH accreditation, as I said, first you need Rohini, then you need Quality Council of India. And for Quality Council of India, these are the things that they will ask you. That is the Biomedical Waste Management, that's the Clinical Establishment Act, registration with the local authorities, with the municipal corporation, and the different certificates which are there. All these certificates which you take for the Clinical Establishment Act help you in making your establishments provide better services to the patient also. You have to take the pollution control certificate. You have to take the fire NOC also. These are certificates which are very important even from the government points of view. These are the different things that I'll ask you. Last year, 3-year balance sheet, bills of equipments, annual maintenance, contract of different equipments. Now, once you take the AMCs, your machines are going to be in better conditions, and definitely you will provide better services to the patients. The NABH will be requiring certificates for the nurses, layout plan of the building, ownership of the premises, Rohini registration, as I earlier said. And if you have a pharmacy, they will ask you for the license. In case of outsourced pharmacy, as I said, in all the things you write outsource and never write it is not available. Hospital management structure and details of the board of directors in its partnership firm, and different things they'll ask you through the NABH accreditation, which is listed here. Now, calibration, medical equipment calibration is very important, and we are almost at the end of this talk. It's not only about CGHS, it's not only about ESI or providing empanelment, this thing. Your equipments are also in a much better state if you constantly get them calibrated. It's the process of ensuring the output of quality of the said equipment is at par with the industry defined standards. There are so many advantages of successful program of equipment management. It helps keep high level of laboratory performance, reduces variability in test outcomes, it lowers repair rates, it extends the life of your machine, decreases service interruptions, it increases the safety for the workers, and produces greater customer satisfaction. Now, for the younger generation, I want you to, this is my last slide, and I would like to say, break free from the myth that the jargon of empanelments are not for me. Because there is so much work to be done, it initially demoralizes the young brigade that maybe I should not go for this, I should just get work somewhere else and not open my own center, because there are so many things to be taken care of. But believe me, once you have passed the 2-year mark, you have started your practice, and once you have empaneled, once you have started the process of empanelment, it will not take more than 6 to 8 months for the entire process to get over, and then you are in league with all the big hospitals that are in your city and town. And empaneling with all these government organizations gives you a much larger patient pool base and really helps you build your practice. Once again, I'd like to thank Dr. Rohan for giving me this opportunity to be sharing my thoughts with all of you. Thank you so much to all of you. Thank you.
Thank you so much, sir, for that exhaustive and comprehensive list on exactly how to go about all of this. And yes, our sessions are being recorded, so we'll be sure to go back and mull over this and gain what we can. So I wanted to ask that of the 28 TPAs that you provided, so that very exhaustive list, so of those, for someone who's beginning in private practice, what what are the 3 to 5 TPAs that one can start with? What would be some good things to be associated with in that?
In different areas, there are, in different regions of the country, there are different TPAs which are more active. In Bombay or Delhi, there may be one TPA which is more active. But more or less, speaking on a broad term, TPAs like HDFC and ICICI banks, which are attached to these third-party insurance, they are some of the most active, like Medi Assist and some safe. I don't remember the name, but some of these are more active, and it's much beneficial to get attached with them. Like Raksha is there, and a lot of them are there. Which in some areas you have more patients, in another area you have more patients. But more or less, if you are empaneled with these government organizations first, like CGHS, and even these private patients who enter your hospital, who are coming, once they see your central government board, their confidence level increases even more. Even if it's only with the HDFC or ACCI, once they see the CGHS board, they are very confident that they have come to the right place.
Sir, I have a question. Sir, if you take a TPA insurance to one of your centers and you have multiple centers across the city, do you need the empanelment for each one of them, or it's just for the hospital in total?
I am not the best person to be answering that, because I do not have multiple centers like that. Dr. Mahipal can answer best that question, or somebody who has multiple centers. But from what I have learned and gained, from what I have seen, is that once your main center is empaneled, it makes it a lot easier to get your other centers also on board of these TPAs and the government organizations.
What about,
If I can...
Yeah, Palak, go ahead.
Sorry to interrupt. If I could just put little information on that question of Pooja's. So I also don't have many centers, but I have worked at places who have multiple centers, and they have one particular center which is empaneled. So what they do is you operate anywhere, but whatever the name of center is with the TPA empanelment, you have to produce documents under that name. So all the billing and all the documents should go by that particular name or that particular stationery. That is what is important. So it really doesn't matter if you are operating at different centers and only one center is empaneled.
So Dr. Sinha, I had one question. These were all the positives of getting empanelment and getting on the government services, but we've all heard about the non-payment of dues and the delays. For a youngster, who has to keep replenishing their inventory, you have operated on a certain amount of patients from ESI or from CGHS, and you're not getting the dues. The government keeps stalling you. Sometimes the backlog is almost, multiple months and years also in some cases. So how do you deal with that situation, sir? I mean, the government is known to be notorious. I know it is changing. The scenario is changing because of digitalization, but still, as a youngster, initially, you've done your surgery, you've put the implant, you've paid for it, but you haven't got reimbursed for it. Then how does that work?
So that's a very good question, Rohan, you have asked me, and it's very important for the youngsters especially. I remember when I said I started the CGHS scheme in 2001, 2002, and I actually remember, because of the delay of patients, I had to go to the CGHS office after 6 months saying, boss, I have still not received my money. And those were the days, but now things have become much faster. Now it does not take 6 to 8 months in CGHS, but in those times it used to take a lot more time. Now, when we are talking of giving credit to the central government, we should also keep into account that we are taking credit from the lens manufacturers also. We don't have to pay them upfront on the same day. They give you a 60-day credit limit or a 90-day credit limit. So that window period is there, and that should be one incentive for the youngsters not to fear that they will be falling in an economic trap, because if they are doing something on credit, they are taking credit also. So that is one window which is there. Obviously, I totally agree with you, but that sometimes it may become difficult for the youngsters. But if you have that much volume, that you have a lot of credit backlog with the IOL guys, you will definitely have a lot of volume with the private patients also by then, that you will be able to clear your dues. And believe me, once the bulk money comes, because I have experienced this, the central government will not pay you, not pay you, not pay you, and then when they pay you such a huge amount that you are actually so happy you can do so many things. I remember my days when I was young. Suddenly, when so much money used to come, and then you can actually invest that lump sum money into some equipment or do something about it. But now over a period, over a period, as you all also will become senior, you will not even realize when the money is coming or whatever is happening. You just keep a track of it. But initially, yes, I totally agree with you. But at times it does become a burden by these delayed payments. But it should not be a deterrent. It should not demoralize you from getting empaneled with this government scheme, because eventually at the end of the day, they pay you, whether it's 6 months or 8 months, a little bit here, there can happen.